Ms. Patterson, I think as a faculty member, the question I want to ask you, because you mentioned policy in your opening statement, are there policies that you can think of, or policies that maybe you've even had experience with, that if they were changed, they would greatly impact the situation we're discussing about disparities among minorities?
I think I want to speak in reference to policies related to the Department of Health, since that's where I live, breathe,
Okay.
and have been.
All right.
One of the things, when we started Office of Minority Health in '91, which was a backdrop from the commission when Dr. Elders was there, she saw the need that many of our policies in reference to just getting people into our health units, we needed to have an emphasis on minority populations. And the reason for that is that if you know anything about Offices of Minority Health, they were birthed in, when Gail Heckler was the secretary in 1984, she did a study and there were no policies in place when she was reviewing the report, and noticed that Americans as a whole looked great, but once she got into the core of the report of 1984 that she was presenting to Congress, she noticed that minority populations were there was such a distance between the two, the majority and the minority groups. And so once she did that report, she set up a task force to look at minority health, but also started the National Office of Minority Health. And I went back to there because one of the things that was happening, this group was not being looked at. I mean, every year she had looked at the reports for several years before she came on board in 1984, and saw that there was a need to look in the areas of health and human services. So that's how Minority Health started. One of the things out of our office within the Department of Health is to be at the forefront of policy. How do we look at our clients? How do we make sure that we're addressing the needs of all the populations? And so we have pushed that, and I'm happy to say today within policy and within the Department of Health, our strategic plan for the agency, which is a first in my year since 1991, that we have put as a core focus of our areas that we will look at reducing health disparities. We're working toward eliminating them, and that's the core of our whole strategic plan for the next 3 years, which will impact on any of the policies that we're presently doing. And then the last comment I want to make, I brought a show and tell, was one of the things when several years ago when we were doing data as far as looking at where we stood, it was hard to tell what the disparities were because many years, probably 10 years back, we only did white, black, and other, and so every year I would go visit our epidemiology department and say, hey, the other is getting larger. Can we start separating it out? And so there was a policy switch there, and we have. And then I'm always an advocate, too, of the Miss Susies of the world, because many of our clients and customers cannot read the graphs. And so thanks to Martha Phillips and our staff within the Department of Health, we did the backdrop of Healthy People 2010, which is the national data. And we wanted a book that not only the EPIs could read, but also the Miss Susies of the world. So if you open this book, and you don't even have to be literate enough to know what it says. You can look at the color and know where you stand in any of the major health disparities areas. So that was a total switch that has impacted and will impact on how we do lots of policy.
Well, I can tell you, for a teacher, I appreciate that approach so much because sometimes we do forget who the audience is. You know, we can read it, we understand it, but it's important to remember that audience, and I appreciate that. Dr. Thomas, you in your comment, you talked some about what AMDPA does and some of its focus of getting more doctors of color into the profession. What would you say are the major reasons there are not proportionate number of minority doctors to the populations in the profession itself, and the kinds of things we could do to really remedy those things as opposed to having to reiterate them year after year after year?
So you got all night, or you got just a few minutes? Or?
No, about a minute. No, but because and don't feel compelled. I know you, because really this really is an introductory. This is an introductory thing. So.
I guess we always look at numbers and we look at how we go about admitting students to any school, But I think if you look at it across the board and just divide it into like a pre-admissions process, and an admissions process, and a retention process. And so we really focused on the pre-admissions process, which is what we take whoever comes, so to speak. And you know, we're not blaming it on the public school system or the private school system or anybody, but you can only take what's out there in the applicant pool. So I think number one, you have to have a better farm system, so to speak. You got to have people to bring into these professional schools. Now, there's certainly some things that we can do as institutions and as organizations to help prepare those students to be competitive, and those we can number. But I think if you look at it across the board, that's one of the places that you need to focus, is that we need to make a better product. Now, if you look at the admissions process, that has many, many layers also. But you have to really decide as an institution, what is my goal? What is my goal? Am I here to create an environment that's diverse, that provides healthcare workers that look like the people that we take care of? Do we want to have parity? You know, those are the questions you have to ask yourself as an admissions, during the admissions process. Now, if you can answer that question and say, yes, I want to move towards diversity, and we can talk about diversity as far as there are bunches of good things about diversity that will come to an institution just because of it. So you have to be willing to make that step and say, yes, I'm going to be committed towards diversifying my workforce, my student workforce, my faculty workforce. And in time, you will develop a cadre of diverse healthcare workers. Now, the other part of it is looking at retention. Now, we do have to put some things within the institution to make sure that we retain those individuals that we bring in. So, and that's an important issue because we all have problems. And most problems in professional school are personal problems. They kind of wind up being academic problems because you can't focus. So if I were to say anything, I would look at the process at 3 levels. And again, there are multiple things that you can talk about at all of those 3 levels. And just a few simple things are a good start.
See, that was a very cogent, very well put answer, Doctor, I must tell you. And I really like the use of your terminology, farm team, so to speak, because I always say, you know, if we approached, you let K-12 off the hook, and I don't tend to do that. But if we approach preparing students the way we prepare them starting in elementary school for sports, and I'm not anti-sports, I was a jock in school, I have to always point that out to people, but we start them very, very young in being prepared to perform at that professional level. I would really like to see us begin to prepare kids academically, both in our homes, in our schools, in our churches, and all the places that they go. Because I know the Legislative Black Caucus, we've talked a great deal with UAMS, and we've had lots of meetings discussing what happens once students get to UAMS. But it is critically important that we address what happens before they even got to a 4-year school, and what happened at the 4-year school. I mean, these are hardcore things we need to begin to address, and not just wait until they're here and go, oh my goodness, somebody is not prepared. Because I just think that's something our community has to get a hold of. That's the end of my sermon.